President Biden says help is on the way to fight the spread of COVID-19.
We're in a national emergency, and it's time we treat it like one.
The president signed several executive orders yesterday to kick off his COVID-19 action plan. He also said the vaccine rollout so far has been a dismal failure. So I want to bring in Dr. Bob Lahita. He's a professor of medicine at the New York Medical College and chairman of medicine at St. Joseph University Hospital. Hey, doctor, good to see
Morning,
you.
Anne-Marie.
Good morning. Dr. Anthony Fauci spoke at yesterday's White House press briefing about the president's COVID-19 vaccine goal. I want to play a little bit of what Dr. Fauci had to say.
I believe that the goal that was set by the president of getting 100 million people vaccinated in the first 100 days is quite a reasonable goal. If we get 70 to 85% of the country vaccinated, let's say by the end of the summer, middle of the summer, I believe by the time we get to the fall, we will be approaching a degree of normality. It's not going to be perfectly normal, but one that I think will take a lot of pressure off the American public.
President Biden's plan also requires masks to be worn on trains, planes, and other public transportation. He's also invoking the Defense Production Act to bolster vaccine and PPE supplies. So, Dr. Lahita, what's your reaction to this plan so far and Dr. Fauci's prediction that we could see some normalcy, he said, by the end of the summer, the beginning of the fall, maybe?
I agree, Anne-Marie. I think Dr. Fauci hit the nail right on the head. What we should see by the end of the summer is the beginning of herd immunity, with all of us being vaccinated or being infected. There is really big light at the end of the tunnel, and I'm looking at normalcy perhaps by September or October. It'd be wonderful. And I think it's wonderful that we all now have to mandatedly wear masks. I think that's a term. We should all wear masks, social distance, wash our hands. This is something that everyone should partake in. This is not a political act. Anne-Marie.
So, Doctor, one of the other things that we are doing now with the Biden administration is rejoining the World Health Organization. And I wanted to ask you a question about some updated guidance that the WHO released interpreting PCR tests for COVID-19. It had to do with cycling. I tried to read it. I had no idea what they were saying, but it seemed to have to do with how we determine whether or not someone is positive or not.
Yes.
Can you shed a little more light on these changes and what ultimately they will mean when it comes to positive or false positive tests?
Yes, it's very, very complicated, but let me see if I can explain it. The PCR test is a polymerase chain reaction which looks at the RNA that is in the viral particle. Okay, so it replicates within the laboratory these particles, this RNA specificity. So the lower the cycles means that you have more virus in your body. The higher the number of cycles means that you could just have a coronavirus of some other type, like the common cold. So if you have, and I think we can pick a number in our lab of 30, if your cycles are above 30, you're not infected. If they're below 30, you're suspicious. And if you can match it to the clinical symptoms, this is what the WHO says, match it to the clinical symptoms, then you should retest and make sure that the cycles are low. If the cycles are low, you're definitely infected. Now, this is very, very important because as the prevalence decreases of the virus, the coronavirus, the cycles may elevate and go higher, and that means that the specificity and sensitivity of the test should not be adhered to. In other words, it provides you with a false positive as the number of clinical cases goes down. So it's really for laboratory personnel and some physicians like immunologists to be concerned about. So that's what the cycles are all about. It's a very easy thing, inversely proportional to the degree of infection that anyone has.
Dr. Bob, in response
to... Sorry, Vlad. So this is connected with the level of infection within the community.
Yes.
What I'm trying to get at is this somehow suggesting that we were getting more false positives before, but this change is going to reduce that? Or is it because, the expectation is fewer people will actually have the infection as it goes down, fingers crossed, and so you need to alter the way you do the testing?
No, the testing would not be altered. It's the interpretation of the test that's very, very important. As we look at low cycles in PCR, we say, gosh, you're really infected. Now, you can be infected for 5 days and show no symptoms. So we would test you and we would say, oh, the cycles are increasing, and the number of cycles that are high mean you're not infected. But if they're very low, the cycles that are very low mean you have more viral particles in your body. So you are truly infected, even though you don't show symptoms. As the prevalence of the disease decreases, and I don't know if your viewers would clearly understand this, the specificity and sensitivity may provide you with false positives as the prevalence decreases.
So, Dr. Bob, in response to vaccine shortages, the CDC updated its guidance yesterday to say that if you can't get the second dose of the COVID-19 vaccine on time, you should still get it within 6 weeks of the first shot. But how effective are these vaccines if you get them past the recommended date for the second dose?
They're still effective, Vlad. These are booster shots, remember. So you can get it, certainly. The 21-day period and the 28-day period for Moderna, 21-day for Pfizer are optimal, meaning that's the best deal. But if we run short on vaccine and can't give you the second shot within, say, 6 weeks, it's still okay. You can get the second shot. You shouldn't get the second shot a year after the first shot. Obviously, that would be ineffective. But, you know, with the changes, the variants that we're beginning to see, et cetera, you want to get that second shot as close to the prescribed time as possible, because there's very little data available that shows that after, say, 8 to 10 or 12 weeks out, that the booster shot's going to provide you with enough immunity to last more than 5 or 6 months. So that's why it's extremely important, Vlad.
All right, Dr. Bob Lahita, as always, we thank you, my friend.
Thank you.